Well, hello. Uh, my name is Dr. Mark Fandel. I'm going to be going over cranial nerves in this video. So cranial nerves are a very special set of nerves. They extend from the brain and the brain stem. They're unique from the spinal nerves, which are all mixed nerves. In this group of nerves, we have some that are sensory only, which means they only have information coming from their receptors going into the brain, and some are primarily motor or motor only, and they have their information going from the brain out. And so the majority of them still are mixed nerves, as they both carry sensory and motor information. But we're going to look at these and see how to test them. They're very important diagnostic tools. And so first to look at how they extend from the brain. This is a view from the inferior side of the brain, and as it comes up you can kind of see these different ones. It labels them here. Now again, I'm not going to use this too much, but just pointing out where they extend from. Now this is a little chart that explains them all. This is kind of small, but this is in your textbook. This is in the McGraw-Hill textbook. And it breaks it down from name, type, and function. Now, in most anatomy and physiology classes, you're going to need to know the name of the nerve, and you will need to know a little bit about Roman numerals with that, because most doctors' offices will list these actually just by the Roman numerals. So just as a little sidebar, 1 obviously equals 1. And I'm sorry that I'm having to write on this, and I know it doesn't look great, but V equals 5 and X equals 10. And the way it works is I have 1, and then I put, that's 2, that's 3. Now when I get to 4, since it's 1 before 5, I put the 1 before the V. And so then you go to 5, and then 6 is V and 1, 7, and then 8. Then when we get to 9, which is 1 before 10, you have the 1 before the X. And then you have 10, and then you have 11, and 12. Now again, just kind of briefly going over those. Don't want this to be about Roman numerals, but it is important to know that. In most classes, you will also need to know about whether it is sensory only, motor only, or as it says here, primarily motor, or mixed. Now at the end of this video, I'm going to go over a few mnemonics and show a fairly straightforward way to remember this. And there's no shame in having a mnemonic to learn this, but you should take that information and transfer it into knowing the actual words. Don't just rely on the mnemonic. Mnemonic is very helpful to get the framework to learn it, but you really should know the names, of course. And then the function, just general ideas. So in this video, we're going to go over each of them, talk a little bit about them, and how to test them. Now, one of the important things to understand is that even though it's going to take a while to go over these, I'm assuming the video will probably be roughly 30 minutes long, you should be able to test these as a well-trained clinician in a matter of a minute to 2 minutes. Now, most of these are going to have manifestations where you won't have to test them to know. Tests just simply back up observation. Again, most of these are going to, you'll be able to tell before the patient even says anything. Or for surely on some of these, especially when they go to say something. So let's get started. So cranial nerve 1 is called the olfactory nerve. This is a sensory only nerve. This is your sense of smell. So in the olfactory nerve, you only have information coming from the upper part of your nasal cavity, which is a specialized chemoreceptor analyzing the chemicals you're breathing in and sending a signal in to tell your brain what you are smelling. All right, so this is one of the most basic of all nerves. And just to kind of point out, this is going to be when you were in 210 and you looked at the bones, you looked at a bone called the ethmoid bone. And so this is the floor of the cranial cavity. This is inside the cranial cavity looking down. And you have these two little parts called the cribriform plates, these little very porous areas, and that's what the olfactory nerve, as it kind of is pointing out here, sits in, and it extends the little receptors through those pores into the upper portion of the nasal cavity. And that's how you can tell what you're smelling. They're analyzing the chemicals. In order to test this, what you would do is you would have the patient, again, you probably want them seated, and again, you'll be able to do multiple tests at one time in a way, but you would have the patient occlude one nostril at a time. So as that would be going on, what you would do, you don't want them to have their finger up their nose, but just off to the side, close the one nostril at a time, and you have the patient breathe normally. You don't have them huff this, they're just breathing normally. And you would put something under the open nostril, something like coffee, vanilla, orange, something that smells good. You don't want to put rotten eggs underneath there. Now, if they can't smell, now, of course, if they have some sort of head cold where their nose is congested, then obviously, you won't be able to test for the nerve function at that point. But what you're looking for is their ability to smell and recognize these odors. These are all very familiar odors. If they have a problem with the cranial nerve itself, they generally won't be able to smell anything, no matter how strong it is. And at that point, if you did put a rotten egg underneath them, they wouldn't even notice it. The other thing that can happen is if they smell it and they can tell that they smell something but can't think of what it is, if it's something that should be familiar, that could be a problem or a lesion with that area of the brain, because in instances like strokes, they will forget, they won't be able to, they can smell, but they can't analyze. But to test it, you're occluding each nostril and putting a familiar smell underneath it, and having them again breathe normally. Cranial nerve 2 is a sensory-only nerve as well. This is again about vision. It's called the optic nerve. Now, this is more than just whether I need glasses or not. As a matter of fact, that's only a small percentage of it, and it's really not the main reason that you might need glasses. What we're doing is we're testing the visual field on this. And so we would generally start with the patient facing us, and we would close, one eye. Let's say we're closing this right eye on this patient. And what I would do is I would have them, I'd have them put their hand over that eye, and then I would put my hand over my left eye, so that we are two eyes that are on the same side as we're facing each other, are next to it. And then I would have my hand on the open eye side. I'll draw the little closed eye here. I don't want to necessarily be an X, but I would have so in this instance, I would have my left hand over my left eye, the patient's right hand over his right eye, and I would use my right hand off to the side to put a set of fingers up for numbers. Like, this person isn't necessarily given the peace sign. Well, he might be, but what he's doing is asking the patient, can they see, and tell him how many fingers they have up. And you want to test this in the lower field down here, and then also in the upper field over here. And you want to do it bilaterally. Another thing is the accommodation test. Now, this is also grouping another cranial nerve, and you'll see that in just a second. But what you're looking for is you'll have your finger or a pen or something in front of the patient, have them look at it, and slowly bring it into between their eyes. And as their eyes start getting crossed, so to speak, you should see that the pupils will constrict. And what we're looking for is that to be even. It's called the accommodation test. Then finally, you can have the patient look at the Snellen eye chart. But again, this is not an eye exam as far as being, whether you have 20/20 vision or whatever. So if you're doing this, you probably want the patient to wear their glasses. There's nothing wrong with that. Because what you're looking for is any visual field disturbances, like, so I can't see a certain spot here, or I have peripheral blindness or medial blindness, or something along those lines, and you're looking for that. And what you're testing is, see, each eye is going to have a part of the neuron that's analyzing the lateral part and the medial part. And as there's a really complicated process, but as they come in, they get integrated. And so what I'm looking for is any problem. So let's say on my left eye, I can't, this area is not working, or I've got a problem here. I'm going to have different visual field disturbances. So that's what you're looking for. So it's more than just, can you read this line of letters? You're looking for visual issues in the visual field. So that's the optic nerve. And again, it is sensory only information coming into the brain on this. Cranial nerve 3 works in tandem with 3, 4, and 6. So cranial nerve 3, cranial nerve 4, and cranial nerve 6 all work together to move the eye. And you can see that cranial nerve 5 right here is jumped over. Now, these 3 are all primarily motor, and I'll go through a little bit about each of them, but again, they work together. So the names are very descriptive. Oculomotor, it's moving the eye. That should tell you something, all right? This one's the bigger of the three cranial nerves that are involved in this. This one also does the accommodation test. Now, the other 2, all right, the trochlea. Now, the trochlea is a pretty interesting thing in the fact that if I was to draw out the orbital socket here where the eye is sitting in, so I want to just kind of draw this as an eye. I know it's a terrible thing, understand, I'm trying. This is my little, I'm just drawing it on the mouse pad. But right here in this corner, I'm going to have this little hook that extends out. And I'm going to have a muscle that attaches over here on the bone. It sticks through this little this arch and then attaches to the eye over here, so that when it contracts, it pulls the eye at an angle. Now, this little pulley part here is called a trochlea. That's what a pulley is. And so this is called the trochlear nerve because it works that muscle. And then we have the last one, this cranial nerve 6, is called the abducens. Now, in the articulations chapter, we looked at different movements, and we talked about abduction and adduction. I'm going to purposely mispronounce that because of my southernese. And so when we see a nerve called the abducens, we should understand that it's going to be contracting a muscle that's going to cause abduction. So on this is going to cause my eye. If this is going to be, so it's going to move laterally. So again, I'm going to draw, and this is a bad picture of a nose, but we'll say this is a nose, so it's going to move laterally. It is abducted. And so these 3 muscles, or these 3 cranial nerves, work on the muscles that move the eye around. And so the way to test them, you really test them as a group, and it is testing the cardinal gazes. And this gives you the idea of the cardinal gazes, but the way you would test this, the patient is seated, obviously their eyes are open. You can take your finger or a pen or any kind of special object if you want, but it can be as simple as a finger. You have them stare at your finger and keep track of it, and you draw a slow H in the air. So as they're staring at it, you're going to draw down and then up and then slowly across and then up and then down. And what you're looking for is something called nystagmus. If they do not have a problem with cranial nerves on this, as they're following your finger, that will move smoothly. But nystagmus is when, let's say that I'm moving across the field this way, and while their eye is following, it starts shaking, and it doesn't follow it really fast, and it just kind of looks like it's fighting it. That's called nystagmus. And I can look and tell, because I can look at these directions, I can tell which cranial nerve, which muscle is a problem, and which cranial nerve is being affected by that. So these 3 work as a package group. So cranial nerve 5 actually works as kind of a package group with cranial nerve 7, we'll see in just a minute. But cranial nerve 5 is called the trigeminal nerve. And as soon as you see something with the word tri in front of it, you should have an idea that there's probably 3 parts to it, and there is on this. Now, this is a mixed nerve. This is the first one we get to that has both sensory and motor aspects to it. and it is the largest of the cranial nerves. It has 3 branches, and the branches are pretty well named. Ophthalmic, this is going to be going to the eye. The maxillary, this is going around the maxilla, the upper jaw, and then the mandibular region, the division, and this is going along the mandibular region. All right. Now, these 3 are really important in the muscles of mastication, those 4 muscles you learned in 210. We commonly call them the time muscles. All right, temporalis, interior pterygoid, masseter, and exterior pterygoid. And remember, the 2 pterygoids can either be interior or exterior, or lateral and medial. But it works these. Now, even though it's a mixed nerve, this is generally tested by sensation. So you would take like a cotton swab, you'd have the patient have their eyes closed, and you would touch them at various parts on their face with the cotton swab. Now, you want to use something that is nice and soft. This is not a time for the pinwheel, the dermatological pinwheel to test anything. This is going to be something that's going to be pretty non-invasive. You just barely touch it with their eyes closed, and you have them just tell you when they feel it. And you want to make sure you test all 3 areas on both sides of the face. Now, like I said, this works with cranial nerve 7, and I'm sorry up here I didn't take this off. That is a problem on my fault there, but this slide is about cranial nerve 7. Now, cranial nerve 7 is called the facial nerve. It works fairly well and close with the trigeminal nerve. This is also a mixed nerve. Now, the big thing about this one is that while it's a mixed nerve, we test it motor is the way we test this one. Now, if you've ever heard of a disease called Bell's palsy is a problem with the facial nerve, this cranial nerve 7. Bell's palsy is a disease that it affects it, and then like half of the face will be paralyzed. And if you've ever seen it, it's pretty obvious. Now, if someone comes in and they have a problem with the facial nerve, you should be able to tell. They should have like a drooping eye or a drooping corner of the mouth. But when you're doing this test, basically what you're going to have them do is make facial expressions. Have them smile, frown, squint their eyes. And you're looking for any disturbances bilaterally. If one side is easier to move than the other or whatever, that could be an issue with the facial nerve. Cranial nerve 8. Now, cranial nerve 8's a very important nerve in a lot of ways, but for us, especially here at Horry Georgetown Tech, this is a nerve that's found on our model. In lab, we go over the eye and the ear. So cranial nerve 2, the optic nerve, and cranial nerve 8, the vestibulocochlear nerve, are pretty important ones because they're on models that we are looking at. Now, several years ago, it was pretty common to call this either the acoustic or auditory nerve because that's a main part of it. But this is no longer really an acceptable term for it. So if you're looking at mnemonics, a lot of times this will be, they'll use an A in this part. I would tell you to either avoid those or make sure if you use a mnemonic that uses that, and we'll talk about mnemonics at the end of this. If you use a mnemonic, make sure you understand that this A is a V. And so the vestibulocochlear nerve is the name that we use. Now, it has 2 branches. Now, the one that we mainly test is the cochlear branch, which is the auditory portion. That's why it used to simply be called the auditory or acoustic nerve. But a very important part is this vestibular branch, and this is about balance and equilibrium. Now, again, if someone has vertigo, there's other reasons to have that, but there is a type of vertigo that's a problem with this portion of the vestibulocochlear nerve. Now, again, generally we do not test the vestibular portion, but if we do, you have to be prepared for the patient to fall and fall quickly. The way you would test it is have them stand it and have them close their eyes. This is probably, in the act of testing this might be the area where your malpractice insurance is tested the most, because a lot of people don't expect people to fall, because as soon as you close your eyes and you've got that proprioception that your eyes give you to give you balance, and you start to rely totally on the vestibular branch, you will collapse. So anyway, that's usually not tested as much. The cochlear branch is the one that's generally tested, and that is your sense of hearing. Now, The two main tests are called Weber and Rhine. All right. The Weber test is you're going to put the tuning fork, both of them use a tuning fork. You're going to put the tuning fork on the crown of the head, and you're looking to see if it is heard evenly. And so again, that's one of the tests. And then the next test is called the Rhine test. You start with, on the Rhine test, you put the tuning fork after you've struck it on the mastoid. And once they stop hearing it on the mastoid, you pull it in front and test the air conduction, and you let them listen to that. And it should be roughly twice as long that you hear it by the ear, by air. And you test that again bilaterally. Then we get to what's called the glossopharyngeal nerve. And the glossopharyngeal nerve is a mixed nerve. Now, just to go back really quickly, the vestibulocochlear nerve is the last of the sensory-only nerves. So the two models that we have, optic and vestibulocochlear, are both sensory-only. And there's only 3 sensory-only nerves. Cranial nerve 1, olfactory, cranial nerve 2, optic, and cranial nerve 8, the vestibulocochlear nerve. So now we get to cranial nerve 9, the glossopharyngeal nerve. Now this is glosso, meaning tongue, pharynx, meaning throat. The glossopharyngeal nerve is going to be a mixed nerve that's going to innervate the pharynx and the posterior part of the tongue. Now, most of this is tested by simply having the patient swallow. Now, I pulled a picture here of, this is a patient just bending their head. I couldn't find a good picture of this, but what happens if someone has a problem with this? When they go to swallow, they will twist and turn their head to recruit other muscles to help them swallow. And if you've ever been to a retirement home or something like that, when you see elderly people swallow, a lot of times you'll see this happen. And part of it's the cranial nerve. Part of it is just as the muscles kind of atrophy, they're not, as you get older, you have a harder time swallowing. But in general, if it's somebody young for sure, and you see them having to twist and turn their neck while they swallow, that is a pretty good sign that the glossopharyngeal nerve is having an issue. Now, this also ties in with the next nerve, the vagus nerve. Now, the vagus nerve, again, before I get far, is a mixed nerve. Right? It has both motor and sensory. But if you look over here, it is amazing what all the vagus nerve does. It innervates the lungs, it innervates the heart, it innervates the liver, the pancreas, the stomach, the spleen, or I said the pancreas, that's the gallbladder. The pancreas over here, it innervates the small intestines and the large intestines. The one thing that I would tell you is in general, it does not innervate the kidney. The kidney you will learn in 211 as it's generally run on autoregulation during the parasympathetic or normal impulses. Very little parasympathetic innervation is going to the kidneys. Now, that's for another time or place, but what I want to point out is the vagus nerve is basically your parasympathetic nervous system. It innervates everything from below your jaw down as far as normal nerve function. A big thing about this, and this is a really important nerve, first of all, every time you go into a hospital or a nursing home, assisted living, whatever, you will find an emergency call button by the commode, and it is because of the vagus nerve, right? The most common place to have a myocardial infarction, or what we commonly call a heart attack, is going number 2. Going to the bathroom puts a strain on your anus and anal sphincters, and they are controlled by the vagus nerve. And if you strain, which is called Valsalva's maneuver, which is all about the vagus nerve, you put a strain on your heart, and you can shut down your heart. That is why going to the bathroom, going number 2, is the most common place to have a heart attack, and why every hospital is going to have an emergency call button right by the commode. Now, as a little bit of a sidebar, a little joke, so to speak, and again, hopefully you all see all I'm trying to do is get some things tied in your head. I grew up in a town called Tupelo, Mississippi, where Elvis was born. And so I was a kind of an Elvis fan growing up. But when I was studying this, it helped me remember that Elvis Presley, who made his living in Vegas, died on the throne from the vagus nerve. And so again, if that helps, that's great. If not, I get it. But understand, Vegas here is not spelled like Vegas. This is Las Vegas. This does not mean sucker bet. It actually means wandering, because the vagus nerve is everywhere. Now, in order to test the vagus nerve, it's pretty simple. One is swallowing. You can see that. But a more specific one is the open up and say ah. This structure right here is called the uvula. And when you say ah, it should go straight up. If you have a lesion, it will deviate one side or the other. Now, if this happens, one thing you have to look at is for tonsils. If you have a swollen, inflamed tonsil, it could cause that. But on a normal condition, if you say ah and it does not go straight up, that is generally a problem with the vagus nerve. Now, just to kind of reiterate, this is an important nerve. When you get into 211, you will get into classes that will talk about the difference between the sympathetic and parasympathetic nervous system on the control of that system. Keep in the back of your brain that the parasympathetic nervous system, for pretty much everything below the chin, so everything you're studying as far as the heart and the digestive tract, the respiratory system. If you talk about the parasympathetic nervous system, you are talking about the vagus nerve, cranial nerve 10. So cranial nerve 11 is called the accessory nerve. It used to be called the spinal accessory nerve. It is not really acceptable for this one because we find it's far more than just the spinal aspect of it, and we'll talk about that in just a second. So if you have a mnemonic that you learn that uses the S at this point, just remember it's called the accessory nerve. It is primarily motor. It's innervating mainly the muscles in the neck area. And you're going to have a cranial and spinal branch. Again, in most of our labs, we don't get into that as much. But the way we test it, here we've got a patient sitting. I'm going to you put your hand against one side of their face and have them turn their head into it. You're testing the sternocleidomastoid, or in common terms, SCM. But remember, when you're in class, it's not common. You have to know it as the sternocleidomastoid muscle. And again, you're not trying to, this isn't a test of wills. You're not trying to break the patient's neck. You're just putting a little slight resistance to see if they can push against it. The other muscle you test is the trapezius. So you put your hands on the shoulders and have the patient try to push their shoulders up, provide a little resistance. Again, you're not trying to show who's stronger, just trying to see that their muscles function. And that's how you test the accessory nerve. And again, it is primarily motor. And then the final one is the hypoglossal nerve. So we said that gloss means tongue, hypo means below. This is a muscle that is primarily motor, and it is innervating the muscles of the tongue. Now, obviously, if you have a problem with this, if a patient comes in with a problem of the hypoglossal nerve, once they start talking, you should be able to tell. In order to test this, as kind of goofy as it sounds, you just have the patient stick out their tongue and move it around. You just make sure that they can move it around, and you will be able to see certain areas that they can't move it if there is a problem with this. So those are the 12 cranial nerves, and a brief explanation of how to test them. And this is a little chart for mnemonics. Now, there is nothing wrong with learning a mnemonic. And like I said, most of the mnemonics you're going to find are going to come from major medical universities because it is a really good way to learn a lot of material in order. But just understand, you need to take the memorization of a mnemonic that just helps you put it in order to the understanding of what the names are. So on this list, I've put the Roman numerals, the actual name, the mnemonics for the name, and the mnemonics for the type. All right, because those are the two most frequently studied parts of this in our classes. Now again, we have on the other chart, it showed the what they do. So there are plenty of different mnemonics, and I will just give you a little warning. If I'm taking a test, when I was a student, if I'm taking a test and I have some mnemonic that I needed to remember, as soon as I got that test, I flipped it over and wrote down the mnemonic. Now, there are mnemonics out there that are not PG, I'll just say. There are some very filthy ones out there. There are plenty of different mnemonics. There are mnemonics with Harry Potter themes, and you name it. There's all kinds of them, but some of them are very dirty, we'll just say. And I learned early on when I was as a professor that people would write down and remember some dirty mnemonics and leave them on the test. I highly recommend, if you've learned a mnemonic and it is something you don't want your parents to see, do not turn it into your professor. Write it down in pencil and erase it before you hand it in. Nobody wants to have a dirty limerick, handed in to them. But these are two basic mnemonics. Again, it doesn't matter which ones you learn. Just make sure you have this framework. Again, if you are the type of person that's got the type of memory that you can just go straight to this and remember them in order, that's awesome. But most people, and again, that's why I brought up that most of these come from major universities. Johns Hopkins, Duke Medical University. They'll use mnemonics to learn the framework in order to remember the actual names. And so on the mnemonics for type, again, since mixed has an M and also motor has an M, we don't want to have the same letter for that. So we usually use B for both for the mixed. And so this again was a mnemonic that I used when I was in school, and it works pretty well. The mnemonic I had for the name had the old names for it, so I didn't list this. This is one I found that I thought was pretty good. So that's a brief overview for the cranial nerves. I hope that this helped, and good luck. Take care.